Hi there. How are you doing? Well, I understand that you might be feeling a little bit nervous due to the nature of the procedure we're about to perform. However, I'd like to say that I was very pleased that you've chosen to go down the local anaesthetic route rather than a general. If it doesn't work, absolutely fine. We can look at putting you to sleep a little bit down the line. But for now, the recovery time will be much quicker and it's a much easier procedure if we can just do it with that local anaesthetic. Let's see how we go. You've had a chance to ask quite a few questions before we've got to this point. We will stay in here just in case of any problems. Do you have any other last minute questions before we start about the Parasite, about the removal process? I will of course be talking you through everything as we go, but just anything that's worrying you at all. Well, once we've got that local anaesthetic, I'm going to put it all the way around your face. We should then be able to just carefully remove that parasite. Then we'll take a look at what needs to be done in terms of recovery for you. But the main thing right now, get that parasite out. We've done all the scans and we know exactly where it is and how to get to it. Unfortunately, it is very close to a few areas where there might be a little damage, but I'll know more once I get in there and start to, well, wiggle it loose. Sure you're okay with a local anaesthetic? Okay, here's what I'm going to do then. Put on some gloves. And then I'm going to have a little feel around your face to begin with. Is that okay? Is there anything painful or uncomfortable? Please let me know. I'll stop. Right. Just around the outside of your face to begin with. Okay, ready? Okay. Is that feeling okay? Just around your forehead. Okay. Just like to have a little feel under the eyes. Is that okay? If it's going to feel tender, it might be here. So just tell me to stop if you need me to, okay? All right. Close your eyes for a second for me. Okay. Look up for me. Okay. Just remind me of your name again. And your date of birth. and tell me the first thing that you're going to do once I've removed that parasite and you're able to walk out of here. Okay. Right, let's start then with some local anaesthetic. It's going to go right the way around your face and over your brows. Is that alright? It'll be quick. So just get a wipe just to sterilise it quickly. Okay? This bit won't hurt at all. This is just to make sure the skin's nice and clean around where it is I'm going to go. Side. Feeling okay? Good stuff. Okay, looking good. If you don't like needles, you can close your eyes now. It's a very fine needle, tiny little needle. Just going to inject it around the points on your face. Okay, ready? Just a very quick little sting will be all it is. Okay, so starting on the right hand side of your face. Okay, here we go. And again, I know obviously we can stop if it is painful, but you can try and get over these little stings. That would be great. Okay, it's going to come to the other side. Alright? Same thing again, here we go. Okay, how was that? Yep, we'll do these forehead ones just quickly. Let me grab another. Okay, just into the forehead. Okay, here we go. Just above the brows. And hopefully you'll start to go numb very quickly, just this side. Okay, how's that? Okay, we'll give it a moment. I used all of the anaesthetic up. There we go. Let's pop that out of the way. Okay, just going to have another feel around. Ready? Starting to go numb. Touch above those eyebrows. Okay. Two important things before I begin. Number one, can you hear me okay? Number two, can you see me okay? Okay. I'm going to have a quick look. This is my pen light. If it's too bright, you can look away. I'm just having a check. I'm getting quite close. I'd quite like to do this with precision. So I'm just looking at the best way to start with this. On the side. I'm just going to hold your face on the side. Okay. Remind me how long you've had this. Okay. So random. Look in your ears quickly. This little light. Sure? Let's see if that's ready. Okay, here we go. Again, don't worry, I'm just looking at the extent of what I need to remove. Ready? Once again, just taking a really good look. Great, thank you. So, you can definitely hear me fine, and you can definitely see me. Is that correct? Good. Sometimes I find with these parasites, they can be very invasive. You can't always tell the extent of the damage till you try and remove it. But that's okay. Let's make a start. So here's what I'm going to do. I'm going to use this scalpel, and it's going to predominantly cut into the parasite and not you, okay? However, it might end up just, I don't know, I may have to just cut into the skin a little bit. And if I do that, once the parasite is removed, then we'll do some precision repairs. We'll leave no scarring. Well, we'll do our best for sure. So this first. There's any little bits of the parasite. I'll be using some tweezers to just pull it away. Is that okay? It sounds horrible, doesn't it? But you've got this. Okay, so one more time before I begin. I'm going to feel, just to check that we're numb. Okay, here we go. You feel that? How about now? Good. And up here. Okay. Remind me one more time of your name. Date of birth. And what time you arrived here today. Okay, good enough for me. Let's begin in that case. I'll be mopping up Any blood as we go. You won't see any blood. It's fine. If you don't like blades, this is mainly harmless, you can look away, but you won't see a lot of anything, okay? What I need you to do is just stay calm. Ready? Okay, here we go. Once I start cutting away, you might well feel the parasite begin to move. I don't like the present. Here we go. So, you might well feel it starting to wriggle and crawl. You'll feel that on your face. You'll feel that around your eyes. What do you think? How does it feel right now? I can already tell it is not enjoying it, and nor should it be. However, we do not want a parasite attached to your face, so it is important that we remove it. You okay? Good. Tell me a fun fact about yourself. Let's distract you a little bit from the wriggling on your face. Tell me something fun about you. Okay, good. Side. Just going to come across this way. Using my left hand. Okay, ready. Okay, same again. So, whoops. Can you feel that? That means it's working. That means it's slowly starting to come free. That's okay. I know it feels horrendous. Something on your face that doesn't belong to you. Something wiggling and jiggling about. It's kind of crawling at the moment. You're getting a crawling feeling across the skin on your face. It's trying to push back in, which is no good really. Not today. I still think there's no damage to your skin at this stage, which is great. It's really, really good. How are those feelings on your face now? Because it really is crawling. Okay. It's okay. It's like, let it struggle. If you feel it on your face, if you're feeling those crawling, wriggling feelings over your face, above your eyebrows, in your eyebrows, that's absolutely fine. It's struggling to keep hold, which is exactly what we want. Okay. Good. Almost ready to attempt an extraction. If you're still feeling okay and you're still feeling like you can, just under that local anaesthetic. Okay, so I'm going to do the one big sweep over the eyebrows. It's where it's sort of most embedded. Okay, here we go. Tell me if you can feel anything. So this is the point at which, if there is going to be any contact with your skin by my scalpel, this is where it will be oh, it does not like that. That's good news. Still hear me okay? Still see me okay? So it's going to look a little aggressive, but I kind of need to be at this point. Okay, how are you feeling? I'm going to say at this point that the immediate priority, once it's been removed, is going to be, I'd like to just look at the optic nerve in your eyes. I have a feeling there might be some damage, and that's okay, because once we can see what's wrong, we can fix it. Right. Just quickly going to, this is just saying, so I can see what I'm doing. Okay, good. And then I'm just going to swipe above the brow, okay? We've kind of gone right the way round. Okay. Just one more look, okay? Just remember, shouldn't really be able to feel anything anymore. The wriggling has predominantly stopped. It's the tricky part for us now, because once removed, well, it's desperate for a new host. But that's not your problem. Okay. That's what we're going to do. I'm going to remove it now. Ready? Okay, if there's any pain at all, please let me know. Okay. Not very surgical, this part. I'm literally going to pull it off. Okay, ready? And there you are. Okay, tell me. I understand this might be a bit worrying now. Can you see well? Because I think you were seeing through the eyes of this parasite right here. I think it might have damaged. Okay, sit tight and we'll get that looked at straight away, okay? Just stay nice and calm for me. You're completely safe. Can you still hear me okay? Wonderful. So, I know you can see me and hear me. The problems you are causing at the moment. Here's the thing though, my patient, nice and safe. Parasites need to be destroyed. Okay, here's what I'm going to do. I'm going to get rid of this parasite now. And then it can't do you any more harm, or anybody else any harm. Yep, I'm going to destroy it, then I'll be right back. We'll take a look at your eyes and we'll look at a plan for going forward. So stay nice and calm for me. There'll be someone else here with you, okay? Good stuff. You've done really well. Well done. As for you, time to go.